state treasurer, how much did you envision the state health plan taking up of your time?
Well, last week I threw away 100 gallons of paper. And going back to the state health plan, these are board books and financial documents going back for the last 16 years. So, I've seen the state health plan in color for a very long time, and it's insolvency for a very long time. With a snap of a finger, the General Assembly could have done so many things to make the state health plan to make the state health plan solvent. And your viewers, not all your viewers are on state benefits, but 1 out of 10 adult North Carolinians are on these pension plans now. 1 out of 10. Nearly 1 million people. And that's the state, local, and as well as the state employees. And I say that because everybody knows that something's wrong with healthcare. And, I've tried to do my job and to get reference-based pricing in the state health plan. That was rejected by who's now going to be the head of the North Carolina Healthcare Association, Josh Dobson, ironically. Reference-based pricing, medical debt de-weaponization, which you reported on exhaustively in such a great fashion. There's about 3 or 4 things the General Assembly could literally just snap their finger and done, and put us on a trajectory of higher quality, higher access, and lower cost of healthcare. But they have not done their job in that respect.
So given it's taken, 10, 11 years to get Medicaid expansion through, and that was a major accomplishment, achieved partly because there was some compromises that were willing to be reached with the certificate of need process and the like. So I would think as you're leaving as treasurer, there's more possibility of maybe getting legislators to realize that what those snap of the fingers could be. Do you feel like there's more reason to be optimistic about that going forward, or do you feel like there's still roadblocks to that kind of reform?
Great question. I'm still optimistic about the antiseptic of sunshine, and we have put a lot of sunshine on this topic. We can't go to reference-based pricing because we lose money on Medicare. False, inaccurate. I think he knew it was a lie. We lose money on Medicaid. False, inaccurate. We proved it. I think he knows that was a lie. False on medical debt, charity care, tax exemption of nonprofits. All these things that you've done such a great job of reporting on. Every single thing, Richard, that he mentioned in that meeting, we have come out with a peer-reviewed report that shows none of that's true. And all your viewers need to understand is that it doesn't matter how they feel about any topic, everyone knows that something's wrong with healthcare. Everyone knows. None of your readers or listeners consume healthcare. It consumes them. It's the only thing in their life they don't know the price and the value of it. You can't tell when you get a bill in the mail, and you and I have both gotten a couple of those, you can't tell if you really have an appendectomy or a tonsillectomy. Those are, it just says facility fee, facility charge. So I think the General Assembly has a real possibility, but they're going to have to pay their bills to the state health plan. The word fiduciary, hopefully not a word your viewers wake up thinking about in the morning, but it's been around 400 years, and it means never put anybody in front of you and your customer. Our customer are those that teach, protect, and serve, and taxpayers like them. And the General Assembly, with all the great things happening with the budget and the surpluses and the rainy day funds and the pension plan, paying off 60% of the state debt, until they make healthcare in the state, which is the worst in the United States. The quality, access, and cost of healthcare is the worst in the United States because the General Assembly doesn't do their job.